Hello, beautiful people. Welcome to Pod with Danny. It's good to have you guys here. And today we're discussing something very important. Guess what we're discussing? Application as a band six nurse. Before we go further into this very important topic, I want you to do one thing for me. Like and subscribe to this page because we have a lot of content coming in that will be very important to you. So you don't want to miss the content. Would you want to miss the content?
I'm not leaving.
Some of us are band 5 nurses and we want to apply as band 6 nurses. A lot of people have missed their chances of being clinical lead because they're scared. I'll be sharing some tips and some recommendation for you guys. As you're preparing for band 6 interview, I'll be sharing some tips for you how to approach this question, what the interviewers are looking out for, and what you should say. So this is what we'll be exploring here. So I have my laptop here with me. I mean, I can't put everything inside my head, but this is a draft of what I have come up with that interviewers for Band 6 job always look out for when they're asking their question, what you should actually tell them. These are what they'll be expecting of you. A lot of people are in the process of thinking, should I do this? Should I not do this? What am I talking about? I'm talking about applying as a Band 6 nurse. The thing about UK is they deal mostly with experience. It's not like other places where they require you to have a lot of certificates, a lot of this and that. But in the UK, they require you to have experience on that post. So if you're applying for a post, they want you to have an experience regarding that post. As an international nurse in the UK, you have doubts. The first thing you think about when you as a band 5 is fear. I mean, you want to apply as a band 6, but you're scared. You'll be thinking, oh, am I good enough? Am I going to fail the interview? Look, the thing is, you can never be sure. As a thing. You can be sure that you've prepared, but you can never be sure if they're going to pick you or not. That's also true about it. But then your level of preparation helps you deal with that fear as well. So if you know what to expect when going for that interview, it will be very helpful for you as it will reduce your anxiety and it will help you not get stuck during interview. But one of the biggest problem is when you ask a question and you literally know nothing about the question and you're sitting there like, what am I going to do? What am I going to say? You don't know this question. Okay, let's start with the basics. So when you are facing a panel, one of the most common questions they might ask you is, tell us about yourself. So this question is not an avenue for you to start saying, oh, so I have 3 sisters, I have 1 car, I am this.
God have mercy upon us.
No, that's not what they want. They don't want you to beat around the bush. So what they want you to do is to summarize your experience, summarize what you're bringing to the table, summarize your skills. So this is very important. So when you're answering that question, you have to be very comprehensive. It does not require you to answer it for an hour, but I mean, you could say something in 3 sentences and it will cover your experience. Say another thing in 3 sentences, it will cover your skills, and say another thing in 3 sentences that will cover what you're bringing to the table. That is literally what they want to hear from you. So let's explore. So when an examiner tells you, tell us about yourself. So the first thing you start is with, I'll be using Tom as an example. So my name is Tom. I'm an enthusiastic, hardworking, compassionate, and caring nurse with over 3 years of working experience. And I have good, keen interest in, it could be orthopedic, it could be mental health, it could be surgery. Depends on what you're applying for. You would like to let them know that you're very interested in that position. Now, your second line is when you talk about what you've done as a band 5 nurse. Now, over the past few years, I have been able to collaborate with multidisciplinary team like doctors, pharmacists, dietitians to provide holistic care to my patient. My care is always patient centered and it revolves around the 6 C's of nursing. Now, these 6 C's of nursing is very important. We'll be talking about them later. So, what you've done here is you've told them that your care is holistic, you provide holistic care to your patient, and the care centers with the 6C. Very important. You've not mentioned your skills. Now, this is where you go. Now, over the years of working, I've also been able to pick up skills which will be relevant to this position. These skills include advocacy skills, leadership skills, ability to work under pressure, ability to delegate tasks to staffs according to competency, clinical auditing skills. Now, you don't need to mention everything at this point, but you have to mention the key skills which are required of a band 6 nurse because that's what they will be looking out for. That you have the skills and you know that's the skills you need for a band 6 job. So after you've highlighted all these things, just end it there. You don't need to say a whole lot of things. You've talked about the skills you're bringing into the table. You've talked about your experience. You've talked about the 6 C's. So that's where you could stop at this point. Let them continue with the question they're asking.
That's what I'm talking about!
Okay, now we've dealt with the tell us about yourself part of the question. Now we'll just dive straight in to the question that relates to the band 6 rule. A very important question the interviewers always ask is what do you understand as a band 6 role or a clinical lead role? So a band 6 role is called a clinical lead role. This is where you let them know what a band 6 role is. Sometimes they might say, what do you understand by a band 6 role? And tell us the skills required of a band 6. So a band 6 nurse is a nurse that's gained some level of clinical experience and undertake some responsibility. It's a leadership role. Definitely you'll be leading. So it's a leadership role. And this person has qualified for a few years and has gained some certain level of experience. As band 6, you require some skills. We shall be talking about the skills. Now, the first of these skills is advocacy. So, depends on where you're working in. As a nurse, you always advocate for your patient, no matter the band you are. You advocate for the patient because there are some patients that cannot talk for themselves, so you help them to talk. Now, advocacy is very important. When you mention these skills, you also explain a little, but like, okay, there's some patient that cannot be able to talk, speak for themselves. It's the responsibility of the clinical lead to speak on their behalf. It might be concerning medication, it might be concerning the way they are treated. Some of them do not have the confidence, so you advocate for them because you always want what's on the best interest of this patient. So that's advocacy is number one. So the second one is delegation of responsibility. Delegating responsibility according to competency. Now, competency is very, very important because if you delegate responsibility to a person that is not confident or competent enough for that duty, you end up having problems. So the third one is ward management skills. So now as a band 6 nurse, you're expected to manage the ward as a lead because it's called a clinical lead role. So you're expected to manage the ward, the day-to-day activity of the ward, delegating of duties to staff according to competencies. This is another skills you need. You could detach it from delegating responsibility. It could be a different skills because some people do not know how to delegate. So, or you could attach it to the ward management skills. Another skills is clinical auditing skills. As a band 6, there's a lot of audit on the ward that you'll be doing. The SHAPS audit, the medication chart audit, the medication audit itself. A lot of audits. So as a band 6, you require the skills. Another skills is conflict resolution. As a band 6, you get people fighting on your ward. I have seen that a whole lot. Where you're in charge of a shift and then your staffs are fighting, you'll be like, gosh, Patient will be stressing me, and then staff will be stressing me. I have been in that shoe. But remember, if you're not able to resolve this conflict, always mention that you refer them to your manager because you're not the only one who could resolve conflict. Another skills you require is leadership and mentorship skills. You'll be mentoring junior ones like band 3, band 4, band 5. So you need leadership and mentorship skills. Also, you need training skills. You'll be training these people, getting feedback from them, the supervision of these people, you know, answering all the questions they need, providing feedback to them. Now, supervision is another skills on its own. So you'll be carrying out a lot of monthly supervision with band 3, band 4, and band 5. Another very key skills you need is collaborating with the MDT and feedbacking. That is a very nice skills because as leader of the shift, the MDT are there, like the doctors, the pharmacists, the nutritionists. So they are there for feedbacks. So as a band 6, you should be able to effectively feedback everything you get from the patient and from the ward to your MDT. What other skills do you need as a band 6? Risk assessment is another skill you need. So you should be able to constantly risk assess your environment, risk assess the patient for any change, drafting of care plans that suit an individual patient. These are skills. These are things you will mention. Now let's move to a very important question the interviewers like to ask. Why do you want to be a band 6 nurse? Now don't go tell them because I want money.
I like money. You know what I'm saying?
The pay between the band 6 and the band 5 is slightly different. The band 6 is paid more. But don't go and tell them I want money. Yeah, I know we all want money, guilty as charged. But there are other things you can gain from a band 6 role, and you know you want to gain. These are things you have to mention. Now, the first one is improvement of my skills. Now, there are skills you already have. So, you would want to improve on that skills and learn new skills. Now, the second one is career advancement. As a band 6 nurse, you'll be learning new things. So all this experience helps you to advance your career because definitely you'll be applying for band 7, band 8, hopefully. When you undertake a band 6 role, you improve yourself career wise. Moving on, there are some things interviewers are looking out for. They want you to mention them. The first is a code of NMC. Prioritize people, practice effectively, preserve safety, promote professionalism and trust. These four codes are very important. Every interviewer are always looking out for this code. Anytime you're answering a question, you could try to put this codes as part of your cares. I always preserve the safety of my patient by constant risk assessing, things like that. They could actually ask you, how do you inculcate the four NMC code into your practice as a nurse? So as a clinical lead, you explain to them, prioritize people, putting people first, duty of candor, these are things you mentioned, ensuring that they are respected, their dignity is upheld, things like that. That's among prioritizing people. Now, preserving safety has to do about constant risk assessment. You could give example like a patient at risk at fall, ensure that they are always safe using aseptic technique, wiping all surfaces to prevent infection. These are part of preserving safety. This code is very important. So make sure you mention this code and you could also give example. The second most important thing is the 6 C's of nursing. Look, interviewers are feasting on the 6 C's of nursing. Now, the first one is care. The second one is compassion. The third one is commitment. The fourth one is courage. The fifth one is competence. And the sixth one is communication. I have seen interviewers who would tell you, how would you integrate it or how do you integrate it into your practice as a nurse? This is self-explanatory. It's putting yourself in the patient's shoes and feeling what they feel by providing the care for them, compassion. You also have to show empathy to his patients. Read up on these 6 C's, very, very important. And most of your questions, always answer them centered on these 6 C's. Interviewers are always looking for the 6 C's. So after this part, these are like the basic parts you are going to be asked. Then the next questions will be scenario-based questions. They would bring some scenario for you and ask you what you're going to do in such scenarios. I want you to put some things at the back of your mind when you're dealing with scenario questions. Now, one of the things you have to put in mind is one is safeguarding, duty of candor, risk assessment. Always put them in your mind, because one of the scenario might be you administer wrong medication to a patient. What would you do? So this question is a duty of candor question and is a safeguarding question. Now the risk assessment should be increasing the patient observation if needed, and then with the 6 C's as well. They're very important. Reassuring is another thing that's very important. Both patient reassuring and patient relative reassuring is very important. That's another thing I didn't mention. Reassuring is very important. It's another skills on your own. So people do not know how to reassure people. So as a leader, you have to know how to reassure patient relative, raise safeguarding when need be, writing an incident report. So another way a scenario question can come for you as a band 6 is you witness your colleagues struggling with a duty you delegate to them, or how are you going to deal with the situation. Now, this is where you utilize your mentorship and training skills, your reassurance skills, and your supervision skills. These are things you have to mention. Actively listen to the staff member, call them, let them explain what is going on, areas they find challenging, provide supervision for them, provide trainings for them, feedback from them concerning areas they're struggling with. You could also refer them either to your manager or the training team to undertake trainings. Some of the trainings you'll not be able to do, so you would refer them for this training. Okay, so finally now, some of your colleagues might have done the band 6 interviews. It will be helpful for you to meet some of them and ask them what you've been asked in that interview. When you have the knowledge of what they have been asked, it does not guarantee that you'll be asked the same thing, but you'll be able to practice a little more. But these are the few things you need to know when you want to go for a band 6 interview. I hope you find this video enlightening and educative. You see all those fear you're having about going for a band 6 interview, throw them away. Now, if you find this video helpful, subscribe and like this video.